Infertility is a devastating medical condition that is affecting a growing number of Canadians. In December 2015, the Ontario government committed to funding one round of in vitro fertilization, otherwise known as IVF, for couples needing this healthcare treatment. A year later, there are waiting lists at clinics right across the province, and the program is now celebrating the first few babies that have been born. Joining us in studio from Conceivable Dreams, an advocacy group working with the government for the treatment of Ontario's infertile couples, is Sandra Alsaffawi and Sarah Sabihuddin, a current participant in the program, obviously a successful one. Congratulations to you.
Thank you very much.
All right, why don't I start with you, Sandra. 1 year into the program launch, can you give us a refresher of how it works and what exactly is funded?
So currently, what's funded is one cycle of IVF per woman for their lifetime. It's for someone who's under the age of 43 years old. And it's really a great program. There's 5,000 funded cycles per year. And I believe we're already at over 4,700 funded cycles this year. So we've had fresh egg transfers. We've had frozen embryo transfers, and they're all tied to a single embryo transfer, which means a healthy pregnancy for mom and baby.
This is the fight you've been pushing for a long time. How do you feel when you're in?
We're incredibly happy. We're very proud of the program that we have in place. The government took the time to build the foundations for a strong program that's sustainable and that we hope we can build on in the years to come.
All right, well, obviously, we said you're a successful participant. Congratulations to you. When's your due date?
January 28th.
All right, so you're well on your way?
Yep, 6 weeks left, and we're looking very forward to the start of our family.
Sarah, tell us a bit about your story and what led you to the program.
Yeah, so my husband and I were referred from our general practitioner to a fertility specialist in February 2014. So it's been quite some time. We did, during the 1.5 years after that, go through a lot of testing and treatments, and we were actually diagnosed medically with unexplained infertility. And that comes with a recommendation for IVF. So we did pursue IVF self-funded September 2015. And that was unsuccessful, unfortunately, at that time. And we did go on the waiting list and were called in February of just this year. And yeah, so that's where we landed.
Tell us about when you got the phone call.
It was, because at that point, it was the last, we had done everything we could, our own, emotionally, physically.
Financially?
Financially, yeah. And we had, that was our last hope. And so getting that call really helped us have that hope again, and renewed hope for having our own family. And so that was a wonderful call to get.
Sandra, one of the controversies that came out when they were first looking at funding this program is the fact that it could take healthcare dollars away from other areas in the country that need funding. There's a real healthcare financial crisis and a crunch in this country. How do you deflect those arguments?
Well, this is a healthcare issue. I mean, you're dealing with people who are dealing with infertility, and typically, for the most part, it's medical infertility. So, for example, if you're a cancer patient and you've gone through chemo and radiation therapy, that sterilizes you. If you're a male and you've got cystic fibrosis, you're born without a vas deferens, so you're not able to conceive that way. So it is a medical health issue for a lot of people. So that's one of the things. The other thing is there's cost savings. Certainly there's an upfront cost to funding the program, but the province is projected to save between $400 and $500 million over the next 10 years through funding this. Healthy moms and healthy babies means shorter hospital stays, less doctor appointments. With a singleton birth, you're not looking at a stay in the neonatal ICU. You're not looking at issues around developmental challenges when you're dealing with multiple births. So the government funding IVF and tying it to a single embryo transfer ensures the safety and the health of mom and baby, but it also means a cost savings to taxpayers in the long run because there's a lot of infrastructure and a lot of resources that they aren't using because they've had healthy pregnancies and births.
Sarah, I want to give the final word to you. How do you feel today?
We're just very hopeful. It's been a long journey, and I'm very excited to start our family in the new year. And I don't think we would have been able to do, I know we wouldn't have been able to do this without that support from the government and the people of Ontario.
Is this your ultrasound?
Yes, it is. That's our little one in there. Boy, girl, we're not sure, but that's our only surprise, really, because we've been through so much. We're just waiting to see.
What has this program meant to you and to couples like you who have gone through that journey, that painful, emotional, financial, exhausting journey?
Yeah, I think that's very true. It is very emotional, and I think that's something that's not really recognized. And so having this opportunity is just so wonderful and great, and I'm so grateful. And I think it'll benefit everyone. And having this little person join us will be a great blessing.
I saw that you called him Pumpkin on your ultrasound.
Yeah, it was that was Thanksgiving.
So I have 2 name suggestions for you.
Okay.
You know, Anne-Marie if it's a girl, Benedict if it's a boy.
Okay.
I think these are fantastic names.
Yeah, there's a big list going right now. So
That's right.
yeah, we don't know yet.
All right, well, congratulations again to you.
Thank
We
you.
wish you a healthy remainder of your pregnancy. Thank you both for being here today.
Thank you.
Thank you.